Hello everybody, my name is Maureen Gilligan McNiff. I'm a registered nurse, and today I'm going to present the topic of adult sensitive training. Okay, why this topic is very important is because that the older adult has special needs, and they are the majority of our patient population in the hospital. The older adult is defined as age 65 and older. Okay. Also, Joint Commission recognizes this population that has special needs and challenges. Okay, and expects hospital personnel to be aware of these challenges and sensitive to their needs. Some of the challenges that Joint Commission addresses is issues such as communication. So what that means is the geriatric population might have issues with decreased hearing, failing eyesight, and things of that nature. Also, environment of care. This could be in the home or in the hospital setting. Okay, so again, about patient safety. Fall prevention is a huge goal for our geriatric population, and definitely something that we need to be aware of and to highlight the high-risk geriatric population that would be at increased fall risks. Medication safety, a huge concern for our geriatric population. As they're living longer, they're on a lot more medications. Okay, with our geriatric population also, we have issues with mental and memory losses. Okay, so a lot of times these patients are possibly, alone. Their spouse has passed. Mental issues, depression, and things of that nature. And finally, another point that Joint Commission wants to address is nutrition and hydration status. Okay, so this again becomes a challenge with the geriatric population because they have decrease in senses. They might not feel hungry, thirsty. They might not be able to go out shopping, financial problems, and things of that nature. So here at this institution, a competency that was put in place was to incorporate a competency related to geriatric sensitivity. So we use the Secure project, and inside this are items that will make us appreciate what the aging process is like, and we'll just go through it. Any questions? Okay, so I will start the video, and
Excuse me, I have a question.
okay.
I work in a pediatric unit. Why do I need to take this course?
Well, this sensitivity training is for everybody. It's just not in the area that you work with, but people that you're dealing outside your environment. Okay, so you come across an older person in the hallway looking for help, and you need to address that and appreciate that maybe they're lost or confused and not knowing where they're going. Also, you could be dealing with family members. They could be caregivers or whatnot, and it's important to have this training. Okay. So with that, I'm going to start the video and take it from there.
Yellow pills. Make sure you keep track of your accuracy after you've made your pill selection. Please stop the program until everyone has completed the exercise.
Yellow.
It's obvious that yellowing of the lens affects your perception of color, especially in the blue-violet range. In the simulation, the white pills looked yellow, and the green pills looked blue. Yellowing of the lens also plays a role in how an older person dresses. They may consider a blue shirt and green pair of pants a color match because they cannot distinguish the colors properly. Unfortunately, we often assume this person does not have any concern for their appearance. While yellowing of the lens affects the ability to distinguish medications and colors, it also can affect how you see street and traffic signs and read words written in different colors. Here's an example. On the right, now here is how an older person sees a curb. The white line indicated it was on a street, but to the older person, the curb looks like a flat surface with a curb that is cracked. Here you can tell you're looking at steps, but determining how far to step down would be a problem for the older adult. That's because as we get older, our ability to judge depth perception diminishes. There is no contrast between the steps or the sidewalk to give any visual clue.
Okay, so Alicia, when you were wearing the yellow tinted glasses, how did you find picking out the pills?
Well, it told me to pick out a yellow pill, and I can see here that I picked out a white pill instead. And then it told me to pick out a blue pill, and I picked out a green.
Okay.
So I had the wrong pills.
Yeah, the wrong pills. Okay. All right. So this exercise obviously makes you respect and appreciate what the older person goes through with different visual impairments. So to wind up, this is a very important competency training to respect the older adult and what goes through and how they have to deal with the aging process and what that does to their body and to their mind. And that's it. Any comments, feedback?
No, I can just see how difficult it will be to see what color pills you have to take. So
Yeah, and that's
you have to make other arrangements with the patients instead of saying the blue pill or the yellow pill.
right.
Because the colors can look different to them.
And it's one of Tri Commission's big, safety requirements dealing with medications, being that so many of these people are on so many medications. So, yeah, that's pretty impressive. I like that part of the
Right.
project. So thank you for listening to me. Thank you very much, guys.